So
Wow.
tell me about this Provenge campaign and Dendrion and prostate cancer. And, you're going to be 50 this fall. So I expect to get invited to your birthday party by now. I figure we're best friends.
Yeah.
So why get involved? And is this something you see yourself doing long term?
Yeah, no, I think it's a great question. Look, I first of all, as an athlete, I had a number of injuries, setbacks. I learned, if anything, you have to take ownership of your health. And when I was introduced and informed in recent years about the issue with prostate cancer, and particularly with the African American community, some of the racial disparities, I knew I had to, get off the sideline and get into the game. I was almost embarrassed that I didn't know, how it disproportionately impacts African American men. And so, yeah, I mean, to be able to partner with Dendrion, and to really, roll out this Start Strong campaign to raise awareness, to give men and women, spouses, mothers, sisters, whatever, to give them a playbook on how to deal with this. We culturally don't typically like to go to the doctor. And obviously, if you can go annually and get screened, and if it's caught early, as it can be treated and you can extend your life. And so just educating, raising awareness, informing the community, giving them the tools necessary to deal with this. We have to bring those numbers down.
Yeah.
And but a lot of it is just it's making people aware. And sadly, a lot of men in our community, they know about prostate cancer, but it's almost nonchalant in a lot of ways in terms of their attitude towards it. And so just getting people to be proactive and advocate for themselves. And so obviously I know people who've had prostate cancer, but it hasn't hit my family. My dad, myself, we haven't had it. But I'm at that age where I have to be, careful. And so that's why we're here. It's a great campaign, and obviously the work that you guys do. I think we talk about sports and collaboration and the spirit of collaboration. Well, all of us working hard to try to bring those numbers down and change this narrative around prostate cancer, particularly in the African American male community.
Yeah, no, I appreciate it, because I always thought one of the biggest problems is when people look at the spokespersons, and I've got to work with most of them. The problem we ran into is a lot of times they were 75, they were 80, and that's, all respect there. But we needed the youth movement. I think it's interesting that at PCRI, the person running the show that helped take us to the next level is 30 years old.
Yep.
And my point being is, it's like coaching. It's like anything else. If you don't start bringing in the youth movement, then you don't have the vision on how to really change this disease. So and what I mean by that is you're also doing something in an ancillary way. I don't know if anyone ever mentioned to you, and this happened. New England Journal of Medicine published this going back to April 29th. It was a diversity of the national medical student body. It's called 4 Decades of Inequities. What people don't realize is that the patients, yes, but we still have less than 5% of our medical students are African American men and women. And for African American men, as an example, I mean, it's still stuck at like 3.5% to 4%. So, we could talk about inequities all day, but if we're not training and teaching and having more African American men and women doctors, what are we doing here? And so I also think these ancillary benefits of what you're doing is going to get more people excited to go into medicine. That's my thought. What do you think?
Yeah, no, I hadn't thought about that, but I think that also plays a role in us. I think it also speaks to the relationship that the African American community has with medicine, not just from a patient standpoint, but also pursuing it as a career, getting into medicine, studying, becoming a doctor. I don't know. It's funny. Like, it's not funny, but it's interesting. I feel like as Black men, we only go to the doctor when there's something wrong. And even when there's something wrong, we're hesitant to go. And I don't know why. I don't know if it's trust. I don't know if it's whatever, but it's just something we have to change. It's not just as it relates to prostate cancer, which is obviously critically important, but it's just your overall healthcare. And take, I've mentioned this before, and obviously, this slogan can be controversial. I don't think it should be, but it can be. But in the recent years, we hear about Black Lives Matter, and we have a good idea of sort of what that means and what that encompasses. But to me, taking care of your health is Black Lives Matter. Advocating for yourself is Black Lives Matter. Going to the doctor annually for checkups is Black Lives Matter. So, if we care about Black Lives Matter, then we are going to get in the game. I'm not asking you to, eat wheatgrass and run 5 miles a day. I'm just asking you to go see the doctor, inform yourself, know what questions to ask, know that you have a right to get a screening, what screenings are available, and just take care of yourself. And so to me, we can, like I said, so we can change that. But to me, like people dying too soon prematurely, the impact that it has on our community is devastating. And so encouraging people to be more selfish so they can be selfless to others. And so, yeah, Black Lives Matter. And part of that is the totality of that is taking care of ourselves.
Thanks so much for watching. If you would like more information about prostate cancer and all sorts of education, you can visit our website, PCRI.org, and subscribe to our YouTube channel. We come out with new prostate cancer education videos every week.